And we're back. 40 minutes gone past 8 a.m. this Saturday morning. And it's still the festive season, but it's a good time for us to discuss your health, my health, which is why we have the show Time Out with Dr. Bone. And Dr. Bone is none other but Dr. Chigozie Ezeh. You're very welcome again on the show. Okay, so I have a few questions that I'd like to ask about, fractures and trauma. Now, can you explain to our listeners, what they need to know about fractures and trauma?
Oh, yes, thank you, Priceless. Fracture is what we see every day. It's a series that even in 13 episodes are not done with fracture. So just going to highlight the salient things. People say, I have fracture. When you ask them what is fracture, they don't know. Fracture simply means a break in the continuity of a structure. In bone, a break in the continuity of the bone.
Okay.
Therefore, the one we call the penile fracture too, a break in the continuity of the penile shaft too. For us, we restrict ourselves to bone.
Okay.
And it can be categorized by different persons and different patterns and the rest of them. Some say the fracture could be open or closed. Open means compound, as in the person had the injury and you can see the bone. The bone is in communication with the exterior, whereas that of a closed, you just see there is deformity, but you cannot see the bone. Yes, which is even much more better. It could be simple, that in the bone breaks into two, or it could be comminuted, breaks into more than two parts. It could be displaced, as in when the bones they break, they shift apart. They are not in alignment, or it could be undisplaced, they are in alignment. If you will look at the pattern of the fractures on X-ray, it could be just a straight cut, transverse. It could be an oblique cut. It could be a spiral cut. It could be a plenty pieces of bones you see on the X-rays. And there's this group which we see that could be pathological and non-pathological, where the cause of the fracture is trivial. A trivial fall in elderly are to fracture the neck of femur. It's a pathological fracture. A diseased bone is a pathological fracture. And the non-pathological fracture are the other ones we see in younger persons that don't have bone disease. Then there are special fractures we see in children. The green stick fracture is broken, but it's not completely broken. So because the periosteum of the children's bone is very thick, and it could be the normal one that is broken. So now, for every fracture that happens, the body starts immediately to attempt to heal it. How do you identify fracture? One, the patient screams pain. There's a force that comes to cause it. The patient screams for pain. There's swelling. There may be redness. There may be deformity. Even the patient says, look now, this leg is no longer straight. Then there's loss of functions. You can't even use it. And I want to talk more about fractures of long bone of the upper limb. We talk of the arm, the humerus, and the forearm. Then we talk of the thigh and the leg. Those are the common ones. Somebody is crossing the road, is hit by Okada or Marwa, is on the floor, he can't get up. Or somebody is falling from a height and stretches out the hand and lands on you see more fractures of the upper limb in children, where they climb on top of the parlor table, they do somersault for the boys, they ride bicycle and the rest of them. And fractures that involve the joint too is delicate to manage. So first thing, the patient is rushed to me. ABC or resuscitation. Is the patient airway clear? Is he breathing? Can he talk? What's your name? You tell me. My name is Sukura. Okay, I know your airway is clear. Are you breathing? You look at the chest. Is the circulation intact? Is it an open fracture or not? We resuscitate the patient and we keep. Mind you, most people think fracture is an emergency. Orthopedics has only 3 emergencies. Fracture is not one of them.
Really?
Because the moment you are able to resuscitate the patient and splint the leg, the patient
is stabilized.
Is stabilized and start waiting for the proper care for X-rays.
Really?
So we now send for X-ray. But most people say, he has broken the leg. Go to call, let's say. They'll do something, doctor. We give painkillers and the patient stops screaming. Set up an IV line. If there's an open wound, give anti-tetanus and the rest of them. Then we now think of the management. It could be conservative or it could be operative. So that each one For the human body, the thigh fracture, the femur is operative.
Okay.
For adults, for children, you can get away operative or non-operative. For the leg bone, the tibia and fibula, may be conservative, may be operative.